Billy is a junior defensive back playing for his high school football team. During a game, he has a collision head-on with another player. He falls over in a daze, and the trainer walks up. Billy is rattled on the ground, is unable to tell what's happened. He asks himself if he's okay. The trainer asks him if he's okay. He says he thinks so. The question that we need to ask ourselves is, what's going on?
What is a concussion? The word concussion comes from the Latin word concutire, meaning to shake violently. It's a sudden and temporary alteration in consciousness induced by traumatic biochemical forces transmitted directly or indirectly to the brain. Concussion causes abrupt release of the neurotransmitter glutamate, an excitatory neurotransmitter. Abnormal ion fluxes, such as extracellular potassium ion and intracellular calcium ion, promote constant neuronal excitation and depolarization.
Billy makes his way to the sideline where his coach and school trainer are waiting. His school trainer enters concussion protocol.
Signs include loss of consciousness, drowsiness, confusion, antegrade or retrograde amnesia, seizure, and irritability. Symptoms include headache, nausea, vomiting, dizziness, fatigue, imbalance, unclear thinking, hallucinations, and sadness.
Researchers conducted a study that surveyed 900 athletic trainers and team physicians from NCAA schools. The purpose of this study was to determine how many of these clinicians had experienced pressure to clear concussed athletes to play. The study found that this pressure came from the coaches and players, with clinicians reporting 64% experiencing such pressure from athletes and 54% experiencing such pressure from coaches. It is especially important for these clinicians to remain unbiased because studies have also shown that high school and college athletes are extremely likely to not report their concussion symptoms. 80% of college athletes and 52% of high school athletes said they would not report such symptoms.
Billy returns to the classroom, and his teacher notices his posture has changed and he physically looks unprepared for learning. In research done by Jierk Jet et al. And Chuli Shan, suggests that COP sway during the quiet stance persists for up to 1 month following a concussion. Meta-analysis was done for a large population of youth sports players to discover incidence rates as well as recurrence rates of concussions and their symptoms. Measuring in athlete exposures, there was an incidence rate average of 0.23 concussions for every 1,000 athlete exposures. In young males, the highest rate was in football players, and in young females, it was soccer.
We must also be aware of how long it takes these athletes to recover from a concussion. Studies have shown that age can affect recovery time, with high school athletes' self-reported symptom recovery at 15 days, while these athletes showed cognitive recovery at 7 days post-concussion. Most providers agree that the best treatment for concussions is rest. Both cognitive and physical rest are necessary following a concussion. The suggestions include limiting activities that require concentration and action. Physical rest includes not participating in resistance or aerobic exercises immediately following a concussion. It is best to resume activity in a stepwise manner, increasing activity slowly if the patient remains asymptomatic.
Long-term effects include clinical depression and deterioration in social and cognitive functions. Public health interventions need to focus on the high school level to prevent the short-term and long-term effects of concussion, starting with educating coaches and athletic trainers alike in the recognition and assessment of concussion.
Created using Powtoon.